Hi there, and welcome to AXSchat. We're delighted to have Jamey Edwards with us today. Jamey is the CEO of Cloudbreak Health. Came to be here today talking with you because of a conversation on Twitter, as always, that I had with Nick Atkins, who runs a Pink Socks movement. So can you explain a little bit about the Pink Socks movement? And I think there's a lot of parallels and crossovers between what we're doing here with AXSchat and some of the stuff that's happening with Pink Socks. And then we can go into the Cloudbreak story and find out more about the good work you're doing there.
Sure. Nick will do the Pink Socks movement a lot more justice than I will, but I'll try and step into his kilt and military boots and see if I can do as good a job. Nick started the Pink Socks movement largely as a little bit of just a genuine spirit of gifting. And it started because Nick was a suit and tie healthcare executive who one day went to Burning Man. And in Burning Man, he experienced, went through all the different stages of climatization and came out on the other side a changed guy with a different mission. And he was besides then, going from wearing pants to wearing a kilt, Nick was still a healthcare executive, and he worked for a startup. And he was at the HIMSS conference, which is one of the largest conferences for health IT in the world. And, he had a friend who had a sock company, and his friend had given him this pair of pink socks with mustaches on it. And he started handing them out. And it was just the spirit of gifting that, again, he had learned at Burning Man. So the thing kind of took on a life of its own, and eventually healthcare leaders from across the world would run into Nick because he's, this loving, open guy who would walk up to you and strike up a conversation. And at the end of the conversation, he'd say something like, you're awesome, I'm awesome, I'm going to give you these socks, have a great day. And it literally changed people's perspective. And so the Pink Socks movement started to take shape. And, healthcare leaders like Jerome Toss from Philips, Jonathan Bush from Athena Health, and others, Eric Topol, all were wearing these socks around. And they became this great conversation starter. And so you'd be walking around these conferences and people would say, hey, I see you're wearing pink socks. And all of a sudden you felt like you were, you had this common ground that wasn't there before. And so, Nick would tell you, look, pink socks are what they are to you. The meaning that you derive from them is a very personal thing. For me, it was been about healthcare innovation, being open to building relationships with other people who you normally might not, just being generally more accepting. I think we all lead life from a little bit of a jaded perspective. We're always on our guard, always protecting. And so for us, the Pink Socks movement was the antithesis of that. It was like, instead, we're going to approach everyone with a little bit of love and a lot of openness. And now there's I think the number is 10,000 pairs of socks have been circulated worldwide. And if you actually map them out, it really covers the globe. So it's been a pretty amazing thing. And we actually at our company, we'll hand them out to people when we're at conferences, and, expecting nothing back. It's just a chance to brighten someone's day.
Fantastic. I think that was the thing that really attracted me. It was a sense of openness and willingness to engage with people in a very accepting way that attracted me. And that's something that we've tried to do with AXSchat. We want to create a community of people that want to change the world in a very positive way. So that's why I first approached Nick, and he said, hey, come and speak to Jamey. He's doing good stuff. So tell us about the good stuff that you're doing with Cloudbreak and what it is, and a bit more about telehealth, because I think this is a really important topic.
Yeah, Cloudbreak is a unified telemedicine company. And what that means is we bring together all of the different healthcare specialties onto a single platform, in many cases onto a single device. It's available on PC, iOS, or Android. And today we're in 700 hospitals across the country. And the genesis of how Cloudbreak got started was actually as a language interpretive service company in healthcare. So helping limited English proficient and deaf and hard of hearing patients communicate with their providers at one of the most scary times of their life, when they're in a hospital. You can imagine that being in a hospital in the States is scary enough when you speak English and they're speaking their doctor talk. But when you don't speak English, it's absolutely terrifying. People running around your bed, shouting things in a foreign language. And the stories that come out of the use of the platform every day are amazing. And so as we grew the company over the course of the last few years, we realized a few things. One, we had built one of the largest private broadband networks into healthcare in the country. So all of our hospitals are connected to us over our private broadband network. We had built a very robust video contact center that allowed us to route a call to the right resource at the right time. And then we had these hospitals that were on the network, again, almost 700 hospitals as the count is today, performing over 75,000 encounters a month. And those encounters now include not only language services, but things like telestroke, things like telepsych, new applications like telesitting. Literally, there's thousands of different use cases for the platform. And so our goal as a company has been to really improve access in healthcare. And we were talking a little bit before the show about this concept of inclusion. Well, our goal is to have everyone included in the healthcare system in a way that is really productive for them. And that led to our mission, which is to humanize healthcare. And, a lot of people say, how can you use technology to humanize healthcare? We do it because our technology helps build connections between people, and we can help increase access to healthcare for someone who previously might not have been able to make it to a hospital to finally receive their care. For a limited English, a Spanish-speaking patient who's undergoing a trying procedure, to finally be able to understand what their provider is saying to them, and really empower the patient to take better care of themselves, and empower the physician to actually make the proper diagnosis. Because prior to having services like ours in place, they weren't really able to do that. So they spent a lot of money on unnecessary testing. There was very low patient satisfaction as a result. Outcomes were worse. So we really see telemedicine being at the crux of helping solve a lot of problems for inclusion and access and quality.
Yeah, that's great. So I know Debra's got a question, so I'm going to hand over to Debra.
Sounds good.
Yeah, Jamey, thank you for being on the program. I'm really in awe of what you're doing. I have a woman that works for my company. Her name is Rosemary Musacchio, and Rosemary sustained an injury at birth, and so she has cerebral palsy. And one of the things that she has is she doesn't have the ability to talk. She can vocalize noises, but she cannot speak. And so she uses a communications device. And she has had so many problems with being in a hospital over the years. It's been horrible. And she's actually written quite a bit about it. And so I think what you're doing is just so powerful. And I have a lot of questions, but one of the questions that I would have for you, Jamey, is why did you get into this? I would be curious immediately because you're making a huge difference, Jamey. So why? About making such a difference.
Yeah, it's a great question. One, I want to thank you guys for having me. Being able to engage in these types of very important discussions and get the word out about healthcare disparities that exist is, again, a primary mission of what we do. So the opportunity to sit down and actually engage in this discussion is an amazing thing for us to do. And so I'm grateful for that. My path of getting into this is actually quite windy. I had always done mission-driven things when I was younger. I was a camp counselor at a special camp for kids with cancer. I was always doing community service type of work. But when I was in undergrad, I took a course in entrepreneurship, and I realized the power of being able to take an idea and make it real and have it, build into something that has meaning. So from my perspective, what I ended up doing was starting to write a bunch of business plans, and I realized that my finance skill set was very weak. And so I actually went into investment banking so that I could build this accounting skill set and this finance skill set so I could get my ideas financed at the end of the day. And I would never be beholden to a CFO who was talking all this financial speak and I couldn't understand it. So a main goal of what I was trying to do was build a competency. And so for the first 10 years of my career, I was an investment banker, and I worked in private equity guy. And I worked on about $8 billion of transactions. I was actually at Lehman Brothers in the communications and media group. And back in 2004 and 5, I started doing a little consulting for someone who's my uncle. And I come from a family of physicians. My sister is a physician. My brother-in-law is a physician. My father-in-law is a physician. My aunts and uncles on both sides are doctors. So I've always been around healthcare in one way, shape, or form. And my uncle, Dr. Irv Edwards, was one of the first guys to come out of the ER residency when it first became a specialty back in the 70s. And he eventually tried to start his own ER company. And so he got his own contract and started building it. Back in 2005, I started doing some consulting for him, and I brought him out of his home office and built, helped him, have a real office. And I built a lot of his infrastructure in Excel and PowerPoint. It was easy for me to impress my physician uncle with all those investment banking skills that you built. But I taught him about EBITDA and cash flow and revenue and all these different types of things. And one day he said, Jamey, the company's growing. I'd like you to come and join us full time as the CEO. So I left what at the time was a very good investment banking job with a lot of great momentum. This was in 2006, before things, obviously went the other way in 7 and 8. And against the advice of all my mentors, I went to work for a small ER group in Southern California called Emergent Medical Associates. And when I joined the group, it was, a small company and seeing, 50, 60,000 patients a year. And when I left about 10 years ago, left 10 years later, the group was seeing 1 million patients a year. We were doing ER, anesthesia, and hospitalist medicine. And one of the great things for me was I shadowed our doctors on the front line of healthcare every day. And I made sure my teams did too. So if you're working in the back office, you rotated through doing shifts in an emergency department. So you could actually see the work, because sometimes it's hard to connect the dots. So I made sure everyone did the rotations. And it was interesting for me. I got to see healthcare from the ground up and see the challenges that were faced, not only by patients, but by providers as well. And being a provider in our country is not an easy thing. Being a physician is a very difficult thing, and patients don't have a lot of compassion for them. So back in 2008, the ER company made an investment, or actually a control group from the ER company did, in a company called the Language Access Network, which was the predecessor company to Cloudbreak Health. And we proceeded to grow Language Access Network. And at the time, it was a distressed business that was about to go bankrupt, and we turned it around. They were about to run out of cash when they came to meet with us. And I really believed in what they were doing. And the founder, Andy Panos, had a great message, and he had a very pure heart in terms of what he was trying to do. He wanted to solve communication problems for limited English proficient patients. And the reason that he wanted to do that is because he had been in Mexico. His brother had been in a car accident, and he was unable to communicate with the provider. And, his brother was actually pronounced dead, even though he wasn't, right? There were things like that happened. Things that I'm sure Rosemary, your friend, faces, right? Every time she goes to a healthcare facility. Because communication is the #1 diagnostic tool a physician has. And when you can't communicate, poor outcomes, poor quality, decreased access, all of those things happen. And so this became a mission, and I ended up raising money for Language Access Network in 2015. So we, worked on the company for 6 years, getting it well positioned. And when we raised money, I went to work at the company full time. I left my job at EMA to go work on this, much smaller startup, because I really believed in the mission. And we had grown EMA to the point where, a different type of management was required, because it wasn't growing as quickly. It was now, how do you manage this big organization? And I'm the idea guy. I like to build things. So I left to go build Language Access Network. We rebranded it as Cloudbreak as we started to become this unified telemedicine company. And, the stories that come out of the use of the platform every day are pretty amazing. Patients who weren't understood before, who now felt understood, who now felt valued, who can now engage in their care. Lives being saved on the telestroke platform. Better care being had because of the telepsychiatrist. So it's been really gratifying. But again, a windy road.
No, and I'm going to turn the mic over to Antonio, but I just want to make a comment that since we're a global chat, that Jamey is in the United States. So along with me, I just want to make that. And then Antonio or Neil, I can't.
Yeah, my
Whoever's
accent
going
didn't give it
next.
away, right? I work out of California. Our company has 7 offices throughout the United States, and we are looking at some international opportunities in Canada, Thailand, and Japan right now. But we are now pretty much solely focused on the U.S.
Yeah, we need you, Antonio.
So, Jamey, in this experience, dealing with doctors, with patients, implementing technology in healthcare, there's a strong element of change. People need to change the way how they work, the way how they communicate. Can you tell us about how you were able to implement that change in terms of how the doctors are working with patients, in the way our patients say, oh, now there's a technology here that we can use. Can you tell us about that journey and what you do to make your system a success case?
Yeah, you guys are keying in on all of the right issues. So in healthcare today, especially when it comes to technology, I would hazard a guess that most physicians would tell you technology hasn't helped them. It's intermediated the care between them and their patients. Instead of me looking at you at the camera and talking to you, Antonio, I'd be documenting in the electronic medical record over here and not making eye contact, right? And so this big revolution that was supposed to happen because of electronic medical records didn't necessarily, or hasn't yet, been the panacea that everyone thought it was going to be. We haven't been able to mine that data the way that we thought artificial intelligence will hopefully help with those types of things. But what it's done is it's led to a cultural challenge when you're asking physicians to adopt new technologies. And let's face it, most of the physicians in the market have been practicing for 10, 20, 30 years, and they've practiced a very specific way during that time period. So they have a lot of embedded synapse, the synapse is firing, saying do it in a specific way. So what we do as a company is we actually have cultural change agents that we call client advocates. And when we go do an implementation, we deploy these client advocates into the field, and their job is to help change the behaviors of the physicians, change the behaviors of the x-ray techs who have said, you know what, I've practiced this way for a certain period of time. I don't need your stinking telemedicine. Or I like working with this interpreter. I don't need to have ready access to your interpreters. So one of the things that we did is we deploy these people, and they literally sit there and they round on the equipment to make sure it's in good working order. So when someone hits the button, right, the system works the way that it should. We've made the system as easy to use as possible so that it can really drive adoption. So we've been very focused on user interface and look and feel and making sure that we've adapted to the physician's workflow as opposed to making the physician adapt to ours. But a lot of it is just repetitive training and in-servicing around letting them know that the system is there. Because in most technologies, what you'll see when you drop the technology off at the door and say, hey, we've done your initial training, it's great, use it, is there'll be a lot of usage in the beginning, and then it slowly starts to tail off as people revert back to their mean behavior or their average behavior, like what they're used to. So what we do is we continually reinforce the new behavior to make sure that it levels off or in fact grows. And in fact, at all of our client partners, if you take a look at the minute packages they initially bought from us, they are all growing. They started at 5,000 minutes. Now they're doing 40,000 minutes a month of different telemedicine services. And it's because we've been able to show them that this creates value and that it makes their lives easier. And doctors in particular, typically what I learned at my previous job at EMA is that they needed to be managed by other physicians. But the other thing I learned is that they respond to data, and they respond to something very tangible, because doctors in the United States, it's all about practicing evidence-based medicine. So you have to show them the evidence and show them how this can make their lives better. And that's what we've really been effective in doing, is showing them not only how it can improve their own lives, but improve the lives of their patients. And doctors, at the end of the day, they care about their patients and they want to do what's right for them.
You mentioned that you have people in the field. Something that I was also interested in your approach to the design of the platform, because I'm sure you have doctors from different ages, who like to do things in a different way. You may have doctors who are colorblind, dyslexic, who might struggle to use the platform. Can you tell us your approach to the design of the platform?
Yeah, our approach is one button, right? Trying to make things as easy for people as we can. So if you, instead of trying to do things in 3 or 4 steps, can we do it in 1 step? It's about reducing the burden on the person using the technology. So the technology eventually fades into the background, right? Like the great things about these devices is they're super intuitive. Now, I think the interesting thing is, like, when my kids were 2 and 3, they understood this immediately. My grandmother's still learning it, right? But I think, it's all about ease of use. And I'm a design thinking disciple. I went to the design thinking boot camp at Stanford and learned from the folks at IDEO. So I'm a big believer in trying to design products people actually love to use, right? And have them engage with it. One of the big complaints about telemedicine today is the patient engagement rates are low. And I think that's because a lot of the healthcare platforms have been designed by IT people instead of by doctors, physicians, and patients. And so we try and engage the community when we're designing our products, so that we're designing something that is easy to use. I'll even say beautiful to look at. If you look at our interfaces, we come from the mantra of, why can't healthcare be fun? Right? We're a little bit edgier than other healthcare companies with our marketing and the things that we do, because I feel like there's all this momentum around, or inertia, in maintaining the status quo in healthcare. And our goal is really to blow the doors off that and change it and get people thinking differently. Why can't we love going to the doctor? Right? I mean, think about that concept for a second. Who loves going to see their physician? I mean, for me, it's a meeting with a great person who can give me great advice. So why can't we all take that when we go to see our doctors? Instead, we have anxiety where we don't want to go. When we wait in the doctor's office, like, I can't believe this physician is keeping me waiting. Well, if patients had a little bit more compassion for what their physicians were going through, and they understood that, hey, that doctor was late because he was seeing a patient who was just diagnosed with terminal cancer and took some extra time out of my appointment so that he could spend time explaining everything that they need, making sure all of their questions were answered, and be a compassionate doctor, I think our ideas as patients would change. But instead, because of things like some of the regulatory laws like HIPAA, the doctor can't say that to us. So what happens? They come into our appointment after doing something really good for somebody else, and they get negative reinforcement. Like, well, I can't believe you kept me waiting. Those are some of the difficulties in the healthcare system that we're trying to get out of it. Yeah,
that's great. So I'm really interested in the potential of remote healthcare, because I see one of the things that affects the community of people with disabilities is, well, there are a number of things. Firstly, mobility is an issue for a large number of people. So the ability to actually get to the doctors, to get help, to have those conversations is limited. So you're solving that problem. Then another area where I think it's really underestimated the impact is the impact of design, right? So you've got people with learning difficulties and conditions like myself with dyslexia, where actually the online processes are so bad that you don't get an appointment either, right? So you've got 2-factor authentication, sometimes 3 or 4-factor authentication before you can even get access to the appointments, by which point they're all gone, and so you don't get the appointment. So that has actually got an impact. I wonder how much of that is actually playing into the fact that people with learning disabilities die earlier. So access to an easy way to go and get advice, where you can talk to someone, I think is of paramount importance. I'm really pleased because actually this times really well, because today is the first day that, as an employee of my employer, Atos, certainly in the UK, we have access to telemedicine.
Oh, nice. Yeah.
So we've got access to a GP, limited calls, but every employee gets at least 3 virtual trips to the doctor every year.
That's great.
Because we're a distributed organization. We all work from home, and actually in the UK, although the healthcare is free, it's still really hard to get an appointment.
Right.
It's still really hard to fit it around work. So I'm seeing that you're at the forefront of the wave of what's coming. So you mentioned that you're you're consulting patients and you're consulting the doctors and everything else. What do you see as the sort of next steps in patient engagement? Because obviously, a lot. I've just mentioned people with learning difficulties, but you have an aging population that are not necessarily digital natives that are finding it harder. How do you don't have the opportunity to go into patients' homes and show them the system? How do you drive adoption with the patients?
Yeah, so that's actually interesting. We very much started off as an e-consult hospital-based model. At the American Telemedicine Association conference 2 or 3 months ago, we launched our e-visit platform so that we actually could do at-home health visits. And we're pairing that with wearables and patient monitoring tools so you can actually deploy kits. You know, you had mentioned mobility. If you take a look at a lot of the closed healthcare systems in the United States, Kaiser Permanente, the Veterans Administration, those systems have deployed telemedicine in huge ways, doing more of their visits in telemedicine than they are in person. Right? There was just a recent stat that came out that said Kaiser had, I think, done 54% of their visits as telemedicine visits versus in-person visits. And when you think about that, the whole place-based nature of telemedicine is changing, and the four walls of the hospital are breaking down. And what we're seeing the evolution of is something that we've called at Cloudbreak branded care networks. Right? It's about taking your existing continuum of care, Neil, and enabling it with telemedicine. That is the model that we think wins the day. There are a lot of companies out there, and there's a place for it. But there are a lot of companies out there who are creating a new continuum of care. There was a study that the RAND group came out with, and they had taken a look at some Blue Cross Blue Shield patients that worked with Teladoc as an example. And the study came out and said, telemedicine increases the use of inpatient visits. That's not true, right? It's true in that scenario because that wasn't my doctor. So what am I going to do after I have my telemedicine visit? And by the way, what's that doctor on the other end going to do as part of good protocol? He's going to say, follow up with your primary care physician or follow up with your pediatrician, right? Because the continuum of care is really important. So what we've tried to do as a company is enable that existing continuum of care so that, you know, Neil and Debra and Antonio can all go to their existing physicians using telemed. And that's really the point of our home health platform. And we're now one of the only platforms in the world that can actually follow a patient all the way from home to the hospital and back again on the same platform, using the same back-end technologies, being part of the same network. And what it means for hospitals in the United States is typically a hospital would work with company A for telepsych, company B for telestroke, company C for home health. And so you couldn't bring the full weight of that institution to bear around a patient as their care team and say, hey, you know what, I'd like to bring on someone from our cardiology team, because they were on different platforms. So our system was built around breaking down those barriers and on letting someone say, hey, you know what, I'd like to bring in a nutritionist. I'd like to bring in so-and-so into this discussion because I think it would be helpful for you. And at the click of the button, bringing in someone from the care team to do that.
Great. I know Debra's got a comment she wants to make.
Yeah, you know, one thing that I've noticed, it's always interesting getting the perspective of, you know, what is healthcare like in the United Kingdom and in Europe and Canada. And as you know, Jamey, it is so complicated right now in the United States. My husband is just turned 65 and went on Medicaid, and I'm a relatively intelligent woman, but I'm telling you, it is so confusing. So then you take the complication of, like you said, all the moving parts and the nutritionist and it is very, very confusing. And then you take somebody that isn't speaking the language proficiently, or, you know, maybe has a thick accent, or once again, like Rosemary, cannot speak in a traditional manner, and it gets very complicated. And I think you're right, a lot of mistakes can be made. So I'm really, really impressed with the work that you're doing. I mean, not only is it very valuable, the physicians and the patients, but you've got to be saving lives and saving people so much money. So you've become my new hero, Jamey. I'm very impressed with what you're doing. I'm so glad we're having you today.
Well, I appreciate that, but you know, there's a lot of people doing great work in this country, and I am no hero. I'm just someone who's, you know, trying to get, you know, the message out and put a platform out there that, again, that people want to use, and all of the resulting great things that happen from it. You know, getting the interpreters, getting these physicians to the point of care are so powerful. But at the end of the day, if you take a look at it, we have so much. You mentioned other countries. other countries have better healthcare systems than the United States. The stats show it out. You know, the WHO has all the statistics to show that we're ranked, you know, X in infant mortality, but we spend Y on care. So the US spends more on care pretty much than any other country in the world, but we don't have the best care as it's generally measured. Now, amazing care is available. The best care is available. But if you measure the system on a whole, it's not there. And I think, you know, when we take a look at healthcare, you had mentioned the nutritionists and everyone, right? It takes a village. And right now we are much more focused on sick care than we are on well care. And if the healthcare system's really working appropriately, not that many people are going to hospitals, right?
Well, and you know what, it's also, yeah, you know what, a couple of things I want to say. We recently, just as a family in the United States, I have a daughter with Down syndrome or trisomy 21, and my husband's having some issues that we're having to deal with. And it is so confusing to navigate. And I agree with you. We focus in the United States on sick care as opposed to keeping us healthy. And my doctor, one of my doctors retired, went and found another wonderful doctor. She left and started practicing concierge medicine, which is great if you have money in the US, but it's very complicated. I think it's going to get worse. And I don't want to just complain about the US because I know there's so many wonderful things about the US, but the work you're doing, it really is beautiful because it's really focused on the patient and us understanding each other. Like you said, I have a doctor now that he spends a lot of time with each patient. And as I'm waiting, I think, but I know I'm going to get that same care. So I'm going to be patient and I'm, you know, so I appreciate the time he takes with me. And I also, as you said, understand sometimes he might be having a very difficult, you know, conversation with another patient. So I can be very patient and understanding and thankful for the time when it comes to me. But I know we're almost out of the time, so let me turn it over to you, Neil. And as you know, it is about the patient's journey. It is, as Antonio wrote in the comment box. So we're very grateful for you, Jamey.
No,
we're grateful.
Again, grateful to have the discussion.
So before I close, I just got a couple of comments. You're doing great stuff, and I'm really interested in how you can bring together the various different disparate silos. How do you think we can go to the next step, which is to connect those silos or break them open globally? Because actually we've got a huge amount of knowledge and people are moving around a lot. You know, people are moving from country to country. Healthcare records don't move with them. How do you think that we can take that to the next step and not have a you know, a localized health system? Because even in the UK, where we have a national health service, there's localized health authorities, localized records, and not everything is connected as it should be. You know, so what's your vision for? Let's end with your vision for, you know, a connected future.
Yeah, you know, I think it's interesting. You mentioned breaking down the silos. What that really is interoperability, right? That's the word that we all use to discuss that. And right now, I don't think there's a lot of incentive for EMR companies to let people make it easy to, you know, take the data out of that system, like, because they see a lot of value in it. They feel like that's, you know, the more data they get into their platform, the more valuable they become. And these are big companies. I think there is work that Epic and Cerner and McKesson, you know, that they're all doing to try and do that. But honestly, I think some sort of government, you know, treaty between countries saying this is how we're going to share data, because that type of stuff doesn't exist today, right? If I travel to the UK, it's a totally different system than the US, which is a totally different system than Canada, and my information doesn't go with me. So in this person-centered healthcare world that's evolving, what we would like to see happen is this concept of a precision care team that follows you around wherever it is. You know, people have been talking about the Precision Medicine Initiative. For us, and you know, it's something we're looking at actually trademarking, is what we're calling precision care teams. And the idea behind a precision care team is you are a unique individual and you have unique needs, unique comorbidities, and you know, your DNA is just different. And so can we use that DNA? Can we use the issues that you're facing to construct a care team that's available for you? So if you are someone who has congestive heart failure, diabetes, and X, Y, and Z syndrome, can we put a care team on a telemedicine app for you that at the push of a button, everyone there has access to your care records? everyone there knows what your situation is and they can give you the appropriate advice. Because going to, you know, a nutritionist who might not be an expert in your specific condition doesn't mean they're going to give you the right foods to eat for your specific situation. Because if they knew that you had X, they might tell you to eat something different, right? So all those different things are coming to play. We refer to that as a precision care team, and we think that's where the future of medicine is. It's in you getting the right care for exactly your needs.
That's fantastic. Love that. Thank you very much. It's been really fascinating chatting with you. We look forward to you joining us on Twitter tomorrow night.
I look forward to it as well. Again, really grateful for the time, and this has been an engaging discussion on healthcare disparities and the like, and the future of healthcare. And you know, anytime you guys want to have it again, I'm game.
Great.
Okay.
Thank you. Bye bye.
Bye bye.